Certainly, if there is a companion diagnostic, so if there's a specific explicit companion diagnostic associated with a targeted therapy or immunotherapy, that companion diagnostic would be covered in conjunction with the assumption that, again, it's going to be used to decide whether or not to use a particular demonstrated effective immunotherapy or targeted therapy or precision therapy. So those would be covered. It gets a little bit more in the gray area where there is a broad range of now biomarkers that have implications in certain cancers, but we're not sure yet what the implications are for therapy. So we're continuing to very vigorously study those kinds of issues, working with some of our key thought creators, thought leaders, in helping us to make those decisions about the use of biomarkers or the coverage of biomarkers as it relates to oncology care. The answer is yes, where again there are certain therapies that are known to work very, very well in select patients, but to be of no clinical utility or clinical value in other patients. Again, there are going to be gray areas where the particular immunotherapy is demonstrated to be extremely effective in a certain cohort with a certain biomarker, KRAS or others, but might also be effective, perhaps less effective, and then we clearly have situations where it's ineffective and maybe can even be counterproductive. So in that sense, we would look for the test to be done prior to the initiation of certain therapies. So the question is the early identification of non-responders, and that is, again, very much aspirational. The sooner, and we're working with certain clinical partners on more rapid elucidation of non-responders using data analytics to more quickly, effectively identify non-responders so that we can move on and with our clinical organizations get that patient perhaps into a clinical trial or using another therapy that might be effective in that situation, or if the situation is such that there are no good alternatives, then looking at palliative care as opposed to treatment type of care. So that looking for non-responders is something we are very much working collaboratively with our oncology clinical partners.